It's Saturday morning skin chats today. I haven't been on in a little bit. We had Mother's Day. I was looking for a house for the new job a few of the last weekends, so I haven't got to get on and do some skincare questions with y'all. So it's good to see you. I appreciate you guys joining today. I hope you're having a good weekend. I had a conference this last Friday, kind of finished up one of the last big conferences of residency, and looking forward to taking some of your guys' skincare questions. A few different milestones, just hit 300,000 on TikTok, so thank you guys so much for your support. It's been awesome. And hit just over 20,000 now on Instagram, so a couple things, and I'm only about 5 followers away from 2,000 subscribers on YouTube. Incredibly appreciative of all your support. So if you have any questions, feel free to ask. So what everyday skincare routine would you recommend? I use Clinique. Hope my English is good. So that's Cher. She just uses the anti-blemish, she says. Yeah, so Clinique is a great brand, very good brand, high quality ingredients in that. The biggest things that I think that everybody should do every single day is basically they should be using a vitamin C serum in the morning, antioxidant serum that's going to help prevent damage and also be somewhat reparative and stabilize their collagen in their skin. Prevent free radical damage, and then they should be applying a sunscreen every single day. They should probably be using an SPF 30 or greater, and then at bedtime I think that everybody pretty much could benefit from a retinoid, unless you're trying to conceive or you're currently pregnant or breastfeeding. Then of course you wouldn't do it. So that's the big stuff. I really like Vichy. I like Maylove. If you got the money for it, like SkinCeuticals is awesome too. Obagi vitamin C is awesome. Those are all great types of vitamin C. For the retinoids over the counter, you can get adapalene, which La Roche-Posay makes, and that's a nice option for people. So Menu asks about acne. So the best things you can do for acne is use benzoyl peroxide cleanser in the morning. I like the CeraVe 4% benzoyl peroxide cleanser. It can bleach fabric, so some people prefer instead to use a salicylic acid cleanser, and you can find great ones from Vichy or Inkey List. Those are all really good brands, so you can do that. The only other thing you need to do is make sure you're using a retinoid at bedtime. A retinoid is pretty much the gold standard treatment for acne, so you got to start it slow, use only a pea-sized amount, use it only 3 days a week, like adapalene. You can get that from Different or La Roche-Posay, and it'll take about 6 weeks to start seeing a difference. Advice for skincare while on Accutane, that's a really good question. Kathleen, when you're on Accutane, Accutane is the main focus of your skincare. You pretty much want to just focus on gentle skincare. So everything gentle, everything on fragrance, moisturization, and sunscreen are really going to be the main thing for you. That's going to be everything. You don't want to be using any actives. You don't want to focus on trying to take care of the scars, anything like that. Any procedures, peels, treatments, any of that stuff happens after Accutane, after your skin is off Accutane for about 6 months or so. And the good news is all your skin products are probably going to work even better after you've been on Accutane. Spider veins on the face. So for spider veins on the face, pretty much the best bet is going to see a cosmetic dermatologist, and you can get a laser treatment called PDL laser done. It's very, very quick and easy. Basically, it can take like 5 minutes. It's pretty painless. They basically zap the areas of redness in blood vessels. The laser is attracted to hemoglobin, which is inside our red blood cells, which are inside the blood vessels. So then when that causes heat, it causes damage to the blood vessels go away, and then you end up removing the redness. So that's the best way to take care of spider veins in the face. They probably shouldn't be injected or anything like that, because some of the injections for spider veins that we do on the legs do have a risk for necrosis, tissue necrosis, meaning the skin kind of dies. So you wouldn't want to do that on the face because you could have a really terrible cosmetic outcome. Can you use vitamin C sunscreen in hot weather, with sunscreen in hot weather? You absolutely can, and honestly, it's the best time to do it because when it's hot out, usually there's also a lot of sun, and if there's a lot of sun, there's a lot of sun damage, and the antioxidant properties of vitamin C can work great in combination with sunscreen. Is cocoa butter on the face good? It seems to work very well and inexpensive. So we just had a talk about this the other day, and a lot of times cocoa butter isn't necessarily like just cocoa butter. There's a lot of things that can be irritating and cause allergy and irritation in the ingredients with it. So it's not always the best thing. If you're looking for a moisturizer, look at something like Vanicream, CeraVe, La Roche-Posay. These are really good moisturizers, and they're all very gentle, fragrance-free, non-comedogenic. They won't block pores. What's a good sunscreen for year-round? Jennifer asked. So I actually just did a video for a really nice one. It's called May Love the Sun Protector. And I just did that video. It's a really good one. Historically, my favorite sunscreen is SwoleMD UV Clear. That May Love sunscreen's amazing. Color Science is another great sunscreen that I really love. You can check any of those out. Can a derm diagnose autoimmune skin rashes like lupus? Absolutely. We do it all the time. We don't just do acne and warts and eczema. We do some complicated medical dermatology too. So we certainly can, and we often work closely with our colleagues in rheumatology and that as well. What can I do about lentigo on my face? So for the people watching, a lentigo is a sunspot. Basically, peels can lighten them. Certain lasers can lighten them, so that's kind of your best bet. Some fading creams can help them as well. So I like Faded by Topicals, really good one. Dark circles, good eye cream like Neocutis. I do list all of my favorite products in the link in my bio on all my social media accounts. So if you click there, go to my Amazon store, you can click eye creams and just look at all the eye creams that you're interested in. And I like Neocutis, and the Ordinary Caffeine Eye Serum is good, and Vichy Mineral 89 is also good. Should African Americans use different skincare products that might be skin specific? Well, I think it's important to know your skin type. A lot of times I find that treatment can be more similar than different, but it is important to kind of like evaluate certain things. So like, for example, if a person with darker skin was using a pure mineral sunscreen that they got at Dollar General or something like that, a cheap one that's not well formulated, then it's going to definitely leave like a very strong white cast on the skin, and it's not going to be like cosmetically acceptable, I would imagine, to the person. So definitely in that regard, there are sunscreens that are formulated for African American skin, and that's probably better. When you talk about cleansers and things like that, like a lot of those things can be the same. African Americans can use chemical peels, which is a big misconception as well. But the thing is, you have to do it with an expert, and you have to do it safely. But it's an unfortunate myth that African Americans can't do chemical peels and that kind of thing. There are definitely differences in some of the cosmetic treatments that we can do. Some of the lasers that we use in lighter colored skin tones is different than what we can use in darker colored skin tones. And a lot of that comes down to the issue of heat. A lot of these lasers cause thermal damage. And when we're using certain types of lasers that are safe to use in lighter colored skin tones, they produce too much heat, and it can leave scarring and that in darker skin tones. So that's why we can't do it. A lot of things are more similar than different, but there certainly are areas where treatment diverges some. So any Rex or darkened spots on the knees known as mom's knees. So you could use amlactin, which is a great lactic acid moisturizer, and just use it. It'd probably take a few months to get improved. Doreen just had DYSPORT for the first time yesterday. What can I expect? Oh, that's cool. Well, congrats. DYSPORT's a great neuromodulator. For you guys who don't know, DYSPORT is basically like another brand of Botox. And honestly, the DYSPORT, Xeomin, Jeuveau, they all kind of work more similarly than different. There are some scientific differences in them that is pretty much not all that practically relevant for day to day. So with DYSPORT, some people notice like a fairly quick onset of muscle weakness. So neuromodulators, how they get rid of wrinkles is basically paralyze or weaken the muscles that contract this way to make lines on like our forehead, for example. So when you relax those muscles, the lines fade away. So it doesn't like lift or tighten in the sense that it tightens the muscle, it actually relaxes it. So usually between 3 and 7 days, you'll have a pretty good onset. You'll probably feel the most kind of like paralyzed in the muscle at 2 weeks. And then that will fade over like 2 to 3 months. Some people can get 4 months out of it. My girlfriend's neuromodulator lasts forever. Mine barely lasts at all. So, a product to reduce pigmentation on the lips. Maybe try using a sunscreen lip balm every single day. And then you can find some nice alpha hydroxy acid lip balms too. And you can use those at bedtime. So things like a brand called Ameliorate. They have that, and that would be a really, really nice option. Recommendations for post-acne hyperpigmentation. So for post-acne hyperpigmentation, this can come in by the way of being dark spots, or it could be potentially red spots. So those are the two issues with it. The things that come to mind are if you're having dark brown spots, you could use some type of fading cream with multiple things to help prevent hyperpigmentation. There's a company called Topicals, and they make a product called Faded, and it does not smell good, I will tell you now, but it can do really good with help removing the kind of brown hyperpigmentation. If redness is more of your concern, you may want to either get laser done by a cosmetic dermatologist, which can provide you pretty rapid results, or you could start adding in some niacinamide into your routine. And some people get irritated by 10% niacinamide. I do just fine with it, but First Aid Beauty does make a 5% niacinamide that would be a nice option for you to use for that concern. Can anything else get rid of forehead lines besides Botox? You can maybe help the appearance with a good skincare regimen for sure, but you're gonna definitely notice the biggest difference with Botox. You're gonna have a pretty immediate result with Botox. With lasers, you may get a little bit of improvement too, but nothing's gonna be as dramatic or dramatic as with Botox. Check me out on YouTube, SwoleMD Skincare. You can hop on there. I do 3 to 5 minute videos. I expand on topics. You know, I can only talk for so long, 15 to now 3 minutes on Instagram too, or on TikTok too. So, but I hope I'll see you guys over there. And if any of you guys do use Twitch, you can swing by. I always live stream on Twitch too. So live Q&A for skincare questions every Sunday. I've been doing giveaways almost every weekend. Yeah, and I appreciate you guys. Thank you guys so much, and I'll see you.